Afternoon, everybody. Well, I'm joined today by Director of Health Bruce Vanderhoff, Recovery Ohio Director Amy Shadwick, Director of Mental Health and Addiction Services Leanne Coran, and Director of Public Safety Andy Wilson. We're here today to announce the results of our latest annual report on the number of drug overdose deaths in the state of Ohio. We do this every year. We're going to give you some of the highlights, but this obviously will be issued today and is available. We know that opioid use, addiction, and overdose touch every corner of our state, every community, and tragically too many Ohio families. That remains true today. There's still much work to do. But I do want to let Ohioans know that we are seeing some progress. The data is getting more encouraging every year. Before we go further, let me, though, take a moment to recognize and think about those whose loved ones have died from an overdose this past year. Every life lost is a tragedy, and our hearts go out to all of those families. When I became governor in 2019, Ohio had seen increases in the number of overdose deaths in 4 of the previous 5 years. Tragically, we were one of the leaders in the country on number of deaths per 100,000. When I took office, I made fighting drug addiction and preventing overdose deaths a top priority of this administration. We created what we call Recovery Ohio. Recovery Ohio is an initiative to bring together state and local partners to tackle substance use disorder in a more unified, a more holistic, a more strategic way, and we've done that. Recovery Ohio has worked alongside our departments of health, mental health and addiction services, as well as public safety. And the directors of these departments are here today and will speak in a moment. We've also involved several other of our agencies with the goal to launch one of the nation's most comprehensive and aggressive strategies to address these challenges. We have steadily been building our programs and our efforts over the past 5 years. With an issue as complex as drug use and addiction, it certainly takes a holistic plan, an all-in approach to make a difference. And even then, it takes a long time to demonstrate success. The latest data that we are releasing today shows that we are making progress. Today, I'm pleased to share that Ohio saw in 2023 a 9% decrease in deaths that year. Let me share 2 important facts. This marks the 2nd year in a row that overdose deaths have decreased, and this latest decrease is even larger than the previous year, which was 5%. So the previous year is 5%, this year is a 9% reduction. This also marks the 2nd year in a row that Ohio's performed far better than the national average. In 2022, overdoses in Ohio decreased by 5%, while they increased by 1% nationwide. In 2023, overdoses in Ohio decreased, as I said, by 9%. While this time they also decreased nationwide, but that was only 2%. So 2% nationwide, 9% in Ohio. The progress that we are making is the result of many factors. I believe that the combined efforts of the agencies here with me, working with our local partners in every county in the state of Ohio, that partnership, I think, makes a big difference. 3 of the cornerstones of our strategy as a state are intervention, treatment, and enforcement. We have several programs underway that the team here today will tell you more about in a moment. But I want to highlight just a few areas where we've been especially successful. and I'll give you the kind of Cliff Notes version. They'll give you more details. First, intervention, particularly in regard to the use of naloxone. Ohio has been a leader in providing expanded access to life-saving naloxone. The Ohio Department of Health's what we call Project Dawn, deaths avoided with naloxone, Project Dawn. Through the Ohio Department of Health, we distribute free naloxone kits throughout the state to help individuals respond to potential overdose deaths with life-saving naloxone intervention. We've been aggressive in this regard. The Ohio Department of Health has increased the number of naloxone kits we've distributed by 520% since 2019. We distributed last year 291,000 kits last year. These kits are in fact saving lives. Last year alone, the Ohio Department of Health confirmed more than 20,000 overdoses were reversed with the naloxone obtained through our administration's Project Dawn. Now that's a conservative estimate. We feel confident in those over 20,000. We believe there were many more besides that. We continue to increase and provide easy access to life-saving naloxone in Ohio's public areas and online at naloxone.ohio.gov. Treatment. We're also expanding access to treatment and recovery services for individuals struggling with substance use disorders, and we are grateful to the Ohio legislature, the members of the Ohio legislature, for providing the funds we need to allow that to happen. First, the number of providers offering comprehensive opioid treatment, counseling, and other support services has more than tripled in Ohio since 2019. Second, we're expanding recovery housing to provide safe and healthy living environments. And three, we're also expanding access to peer supporters. Peer supporters are people who formerly struggled with addiction. They, in turn, help others with their own recovery journeys. We have found that these peer supporters are particularly helpful in this endeavor. Peer supporters are especially effective because people going through addiction trust people more who have been in their shoes and have succeeded in their recovery. And third is enforcement. Ohio's teamed up with law enforcement agencies to crack down on drug trafficking and increase penalties for drug crimes. We created the Ohio Narcotics Intelligence Center, ONIC, shortly after I took office. Created in 2019, ONIC uses cutting-edge technology and data to intercept dangerous drugs. Since 2019, the Ohio State Highway Patrol has contributed to removing nearly 110,000 doses of opiates and more than 900 pounds of fentanyl from Ohio's roads. That's a lot of drugs that we're keeping out of the hands of Ohioans, making Ohio residents safer. Additionally, in 2023 alone, our administration awarded $2.4 million to 32 drug task forces in Ohio to help dismantle large drug trafficking organizations. Finally, we're making, in conclusion, real progress. As we look at the preliminary data for 2024, it appears that we will continue to make progress in this regard. We obviously do not have those final numbers and will not for some time, but as we look at the preliminary numbers for 2024, what we see is that the progress that we have made in 2023 is continuing at about the same rate. While we celebrate this accomplishment, we know that our work is far from over. And we also know that families continue to suffer who have lost a loved one. We also know we have other families who are struggling with someone in the family to try to help them deal with their addiction, and that weighs very heavily on the family members. Every overdose death represents a son, daughter, sister, brother, mother, father. We owe it to every Ohio family, every person struggling with addiction, to continue this battle and continue to do the things that we are doing and continue to look forward to saving more lives. Now let me introduce Dr. Vanderhoff to give you some more details.
Well, thank you, Governor. And as the Governor noted, This report is an affirmation of real progress here in Ohio in our ongoing efforts to reduce overdose deaths. You know, it wasn't all that long ago that Ohio was center stage as an epicenter of the opioid crisis. We peaked, in fact, in 2016 and 2017. Both years we were number 2 in the nation in terms of having the highest rate of overdose deaths in the country. Since then, we have dropped. In 2021, we dropped to number 8. And then again in 22, we dropped to 9th. And now in this most recent reporting year, 2023, we are down to 12th. And indications are strong that that trend is likely to continue. In fact, if you look at our data in 2023, the first half of the year compared to the second half of the year, there was an actual acceleration in the improvement in the second half of the year. And preliminary data for 2024 is equally encouraging. And the governor referenced the fact that there are many reasons for this, but one very big reason that I want to underline is leadership, and particularly the leadership of Mike DeWine. He has prioritized this issue from the very beginning of his administration, and he has challenged his cabinet, the leaders of his agencies, to continue to look for opportunities to make improvements, to help save more lives, to help more people succeed on the journey to recovery, and to raising awareness among all of us. I am really thankful for that as the director of the Department of Health, because it really fuels our mission of working hard every day to advance the health and well-being of all Ohioans. The governor referenced one of our programs, the Ohio Department of Health naloxone distribution program. It's a program that we're very proud of, and it's a program, though, that we're able to be successful with because of support from many directions, including other agencies. This program empowers every Ohioan to be a lifesaver by giving them access to naloxone, a medication that can very effectively reverse an opiate overdose. You know, prior to its availability, there were just too many stories of loved ones and friends of someone who clearly had overdosed, who had nothing at hand that they could use to save that life. Well, this changes that, access to naloxone. And importantly, access to naloxone also keeps the door open for someone to enter into their journey of recovery another day. We've grown since 2012 from one site in Ohio to distributing, as the governor shared, through hundreds of sites, almost 300,000 naloxone kits last year. And as he noted, we know we've saved at least 20,000 individuals from having overdosed fatally. And we continue to look for new ways to expand access to this life-saving medication, one of which the governor also referenced, which is online at naloxone.ohio.gov. Now, we also, at the Ohio Department of Health, are very proud of another program that has been in place for the last several years, our Ohio Department of Health Emergency Room Comprehensive Care Program. That program has screened a large number of people, in fact, over 800,000 individuals in our emergency rooms. And it is linked to more than 19,000 individuals being linked to recovery services and other support in the state. And it brings a holistic, comprehensive approach to the care of individuals who hit our emergency rooms having suffered from an overdose. And that comprehensive approach includes one of the resources the governor referenced, those peer recovery, those peer support individuals, helping people at a crucial moment make that decision to enter into recovery. So as the governor highlighted, these and other programs are making a real difference in Ohio. They're clearly saving lives, helping more people into recovery, and raising awareness among all of us. And I think it's progress that really should give all of us in Ohio real hope for our future. And with that, I'm going to turn to my colleague, Amy Shadwick, the Director of Recovery Ohio.
Thanks, Dr. Vanderhoff. And thank you, Governor DeWine, for your leadership and commitment to addressing the overdose crisis in Ohio. And thank you all for being with us today. I'm honored to join you as we reflect on the progress we've made and the work that still lies ahead. Moments after taking the oath of office, Governor DeWine's first official action was to create the Recovery Ohio Initiative. This bold but necessary step demonstrated his commitment to lifting up our state and addressing the toll that addiction and mental health have taken on Ohio. The governor's deep commitment to addressing substance use disorder reflects his understanding of how critical this issue is to the well-being of Ohio's families, communities, and workforce. He has made it clear that saving lives and supporting recovery are central to creating a healthy and thriving state. I'm humbled to serve as his Director of Recovery Ohio. I care about this work on a professional and personal level, as I have a family member who is in recovery from a substance use disorder. As the governor mentioned, Ohio saw a 9% decrease in overdose deaths in 2023, our second consecutive year of decline. This achievement is a testament to our comprehensive strategy, which combines prevention, harm reduction, treatment, interdiction, and recovery efforts. Behind each of these numbers is a family saved and a family spared the heartache of loss, like my family. This progress is no accident. It results from deliberate, coordinated efforts and targeted strategies working together to save lives. Our 9% decrease in overdose deaths, outpacing the national average, demonstrates that Ohio's approach is making a measurable impact. With the right resources, support, and partnerships, we can turn the tide of this crisis. As you heard from both the governor and Dr. Vanderhoff, harm reduction remains a cornerstone of our strategy, and naloxone is at the center of this life-saving effort. You heard the numbers about naloxone distribution and overdose reversals, but we're doing even more to put this life-saving medication into the hands of people who need it. As we mentioned, Recovery Ohio is about collaboration, and it's about challenging our state agencies to do more. So we've also partnered with the Ohio Department of Transportation to place 130 naloxone cabinets at 65 rest areas across Ohio, plus 14 more of those same naloxone cabinets at service plazas, working with the Ohio Turnpike Commission. We also partnered with the Ohio Department of Education to offer nalox boxes to colleges and universities, and 58 colleges and universities have installed naloxone cabinets on their campuses. As you heard from Dr. Vanderhoff, we've also launched naloxone.ohio.gov. That website is a website where any Ohioan can request free naloxone to be mailed directly to their home. This resource also allows people to order fentanyl test strips, providing an additional tool to prevent overdoses and support safer decision-making. Those fentanyl test strips help keep people alive so they have a chance to find treatment and experience what life is like living in recovery. Ohio's efforts don't stop there. Another important part of our strategy is centered on workforce. Studies show that employment provides more than financial stability. It fosters purpose, structure, and self-esteem, all of which are key to maintaining sobriety and rebuilding life after addiction. The Substance Abuse and Mental Health Services Administration reports that individuals who maintain employment during recovery experience a higher quality of life and a lower relapse rate. So that's why Recovery Ohio launched the Ohio Recovery Friendly Workplace Program in August. It helps employers create supportive environments where employees in recovery can thrive. To date, we've designated 33 businesses as recovery friendly, and we're working with more companies to provide training and education and resources that reduce stigma and foster recovery and mental health support. These examples that I shared emphasize our dual focus: immediate life-saving interventions like naloxone and fentanyl test strips, also paired with our long-term support for recovery, such as pathways to meaningful employment. Together, these examples of our initiatives offer immediate aid while also building the foundation for lasting recovery. The collaboration among our state agencies here today, the Department of Health, the Department of Mental Health and Addiction Services, and the Department of Public Safety is making a significant impact. Together, we're building a safer, healthier Ohio, one where fewer lives are lost to overdose and more people find a path to recovery and wellness. As we reflect on this decrease, we have more to do and more lives to save. We will continue to expand treatment and mental health services, increase harm reduction strategies, and strengthen partnerships that support long-term wellness and recovery. So thank you for your time today, and at this time, I'd like to introduce you to Leanne Cornian, who is the Director of the Ohio Department of Mental Health and Addiction Services.
Thank you, Director Shadwick. Today's data provides a glimmer of hope that our state's efforts to save lives from opioid overdose deaths is having an impact. We know that naloxone saves lives, treatment works, and recovery is possible. Our progress as a state is worth celebrating, but now is no time to lose our focus or our resolve. At Ohio MOS, we are committed to making behavioral health services and supports more visible, accessible, and effective for Ohioans. We are doing this in a few ways. First, increasing the availability of opioid treatment providers, expanding recovery housing, and growing our peer support profession. Across Ohio, opioid treatment providers are addressing the whole person needs of nearly 38,000 unique Ohioans, delivering medication for opioid use disorder, counseling, infectious disease prevention, and so much more. In just 5 years, the number of OTPs has grown by nearly 300%, from just 35 in 2019 to 125 today, with an additional 15 in process. And we're striving to meet the needs of Ohioans where they are at, with 5 medication units in DRC prisons, 1 in Ohio's federal prison, and 3 in VA facilities across the state. In short, we've increased options for people accessing treatment, which means services are available when and where they are needed most. This is absolutely critical because research tells us that when a person is motivated to change, it's vitally important that he or she has access to treatment to achieve the best possible outcomes. But we want treatment to be a point in time, and we want an individual to live in recovery for the rest of their life. So we know that recovery services are also critical to saving lives. And having a safe and stable place to live is an essential part of recovery and can help a person succeed in their treatment as well. That is why Ohio MOS is committed to enhancing supportive community living options for people living with or recovering from mental illness or a substance use disorder. Under Governor DeWine's leadership and with support of the General Assembly, we've invested more than $73 million to help finance nearly 200 projects and thousands of new housing units for individuals with mental illness and or substance use disorder. These projects help Ohioans live with dignity, thrive in their communities, and sustain their recovery. In this role, I've had the opportunity to meet with many Ohioans in recovery from opioid use disorder. And there is one unifying factor in almost every single one of their personal stories, and that is the invaluable role of a peer to their recovery. We know that lived experience is powerful. Peer supporters are individuals in recovery from substance use disorder or mental illness. They leverage their personal experience to help others achieve and sustain their recovery through perspective, through empathy, but most importantly, through hope. Since 2019, we've certified 6,000 new peer supporters, and 3,300 of those individuals remain in the field currently. We've also increased the types of peer certifications available to include youth and family peer certifications in addition to the adult peer recovery supporter certification. And in 2021, Ohio began offering peer support training in our prisons. To date, more than 500 individuals have completed that peer supporter training in DRC facilities across the state. Starting last month, we began certifying peers on parole and probation with the ultimate goal of certifying individuals prior to their release, giving them a pathway to meaningful employment back in their communities. And I'm especially proud to note that at Ohio Moss, we are leading by example. We employ a number of people in recovery, both in our central office and in our regional psychiatric hospitals. These dedicated colleagues draw upon their own lived experience to help enrich and brighten the lives of the Ohioans that we serve. So the bottom line is this: we aren't here today because of happenstance, as Director Shadwick said. We are here today because of years of hard work at the state and local level. There's so much more to do, but because of Governor DeWine's leadership and historic investments in the behavioral health field, we are able to help more Ohioans be well, get well, and stay well. It is now my pleasure to introduce Andy Wilson, the Director of the Ohio Department of Public Safety.
As you've heard this afternoon, when it comes to addressing the problem of drugs and drug deaths in our communities, it's a three-legged stool. It's the intervention, it's the treatment, and the enforcement. And every one of those legs has to be strong in order for that stool to be steady. At the Ohio Department of Public Safety, we do a lot of work in the prevention and education field, but really what we focus on is enforcement. And enforcement and interdiction is a huge part of stopping these drugs, stopping this poison from getting into our communities. And the enforcement piece is the part where we arrest and prosecute the people who are willing to peddle that poison into our communities, into the hands of our friends, families, and our neighbors. Since 2019, Governor DeWine has been just a leader in the area of enforcement. And what you've seen, again, a lot of it goes back to his background as a prosecutor and as Attorney General, but what you've seen is a layered approach to enforcement when it comes to keeping these drugs out of our communities. And it's layered with efforts at the local level, layered with efforts at the state level, and layered with efforts at the federal level. I'm going to talk, I'll open up with what the governor's done really to support our local partners. Again, because of the governor's background as Attorney General and prosecutor, he understands the nature of this problem, and he also understands the value of analysts in fighting this problem. And what he saw, what he understood, is that drug dealers in this day and age are doing their business on their phones. Again, we saw that Attorney Generals, we see it across the state. They are buying and selling drugs using phones and electronics. The problem is, 10 years ago, if you got a drug dealer's phone or you went to an overdose and you took or a death, you took the phone off of the deceased, you would send that off to get it analyzed or get it downloaded. It would take weeks, months, to get that phone back. In that time, the drug dealer, or whoever was using that phone to peddle their drugs, was free to, again, put more drugs back out on our streets. So the governor, understanding the value of analysts, when the administration started 2019, said, look, we have got to do something that allows this resource to be available to our local partners. And that's where the Ohio Narcotics Intelligence Center came from. And the bread and butter of what we do at the Narcotics Intelligence Center is we help locals. We take electronics that they get from scenes. We then download those electronics, and then we have analysts who go through the information in the phones. You may have thousands and thousands of texts or pictures related to drug dealing in that phone. Local detectives, local law enforcement agencies, a lot of times don't have the personnel to sit and go through that. We do it for them. And then what we hand them, really on a silver platter, is a story of what that drug dealer is doing. And it's an incredible resource for our local law enforcement agencies. So far in 2024, I'm not going to go through since 2019, but just in 2024, we've opened 717 cases in the ONIC, and we've analyzed 3,094 devices. Again, those are resources that would otherwise have to be utilized or otherwise not to be available to local law enforcement agencies, but for the existence of the Narcotics Intelligence Center. We also have a unit there that specializes in the dark web and cryptocurrency. Again, we see our drug dealers a lot of times now using crypto and the dark web to do their drugs. We have translators on site where we can help local agencies translate. And then we also do something called a monthly drug trends call. This has been incredible. So there's usually about 180 to 200 people. These are people across the state. It's not just law enforcement specific. You have teachers, you have treatment providers, and what we talk about is what we're seeing across Ohio with respect to trends in drugs making their way in our community. This drug trends call has allowed Governor DeWine to really get out front when we're talking about synthetics like xylazine or new drug trends that are coming in. And it allows the governor, again, a lot of times before any other state, to get out and schedule those drugs and to protect our folks from doing, from the harm that they cause. I want to talk a little bit about the Highway Patrol at the state level. So that we talked about local support. At the state level, our troopers are out on the highway every day interdicting people who are bringing drugs into the state using our roads and highways and people who are moving drugs around on our roads and highways. The governor talked about since 2019, over 900 pounds of fentanyl have been seized by the Highway Patrol. Just in 2024 alone, over 601 pounds of cocaine and 1,144 pounds of meth have been seized. We have a specialized unit. We have a specialized unit that sits up on the highway, typically in our Tahoes. They sit up there and they're not running traffic. They're watching. There are very distinct patterns that drug traffickers have. They've been trained in those patterns. They know what to watch for. So they watch for those patterns and they interdict drugs that are coming really typically from the southern border. And they pick those drugs off as they come in to our country or to our state. Not only that, but they are available and they train the local law enforcement agencies as well. The patrol, in addition to just doing the fist of enforcement, they come with the heart as well. In 2023, we started a program called Operation New Beginnings. And that's where when we pick somebody up for an OVI or a substance abuse, we work with the local treatment providers to plug them in immediately to treatment resources. And there's a follow-up so the person doesn't just get lost in the system. It's a great program. And finally, I want to talk about the governor's efforts at the border. If you have a broken pipe in your house and it's shooting water all over a room, you can mop it up, you can mop it up, you can mop it up, but until you get and actually fix that pipe, you're just running on a hamster wheel. The governor has been passionate about helping to try to cut off the drug flow at the sources. At the southern border, we've sent National Guard troopers. I know the governor's been to the border himself. I've been to the border twice. We've also sent State Highway Patrol folks to help Texas, to help the other states stem the flow of drugs that ultimately we know, even though they're coming across the southern border, they're ultimately making their way into our neighborhoods. Again, all of these resources, all of these initiatives have resulted in the governor and his administration doing enforcement at the federal level, doing enforcement at our state border, and doing enforcement in our local communities. So thank you.
So we're happy to answer any questions. I'll let the director answer that.
So again, we know that the cartel, there's been talk about the cartel tamping down the amount of fentanyl that they're putting in their drugs. But what I tell you, what we have seen is we've seen an increase in meth and other drugs. So any drug that could be handed to my kid in their school, meth, cocaine, whatever it is, we need to work on interdicting coming to state. That's what you've seen from the governor. So it's really kind of, we work very closely with the DEA on different task forces, especially in the crypto space, in interdicting the cartel drugs that are coming through.
I have a question about the demographics. My understanding is that nationally, overdoses fell for white people, but didn't for non-white people. They increased among non-white individuals. Can you talk about that trend in Ohio?
Well, if you look at the report, when you get access to it today, you'll actually see improvements that embrace all Ohioans. So we actually do see decreases in the overdose death rate among our African American population as well as other populations.
Are the rates similar, or are the reductions higher for white folks?
We're seeing, I don't have the numbers right in front of me. If you look at the graphs, you'll see they're fairly dramatic for all.
Research has shown that typically before people turn to drugs, they're having issues with mental health or economic problems. What else, other than law enforcement involvement, is being done to stop substance abuse before it gets to the point of needing Narcan? So we know that many Ohioans struggle with behavioral health crises. In the state of Ohio, we have launched a statewide 988 system, which any Ohioan can call. It's 24/7. It's completely free. It's totally confidential. And they can call if they are struggling with an emotional crisis or a substance use crisis. You can even call on behalf of your family member if they are struggling as well. Call, text, or chat is all available. And to that same end, the governor has committed our state to building out our crisis response system. So in September of this year, the Ohio Department of Mental Health and Addiction Services issued a request for proposal to build out statewide mobile response for youth under the age of 21. We know that young people who are able to access that service, which is currently available in 54 counties, have seen dramatic reductions in their need for hospitalization, both for a mental health condition or a substance use disorder. So we know that those crisis services are helping people to not end up in the emergency department or in jail. And we also are helping to spread evidence-based prevention curricula in more schools across the state. We have a program called Sources of Strength, which is focused on building pro-social behaviors amongst young people. We have made it completely free of charge for schools, and we are impacting over 150,000 youth in almost 400 schools across the state. And certainly it's something the governor has been championing since his very first day in office, ensuring that there's evidence-based prevention in every single classroom, every single school year for every single student in Ohio.
So look, I mean, I don't want anybody, just because we ended with Andy doesn't mean that, we're totally focused on the law enforcement. The law enforcement is important, but it takes a holistic approach. And I think that's, why we took some time today to hear from the different directors, because it really truly is a team effort, but it's also a team effort with the local people who are working with all of these areas as well. So who else? Yeah, I missed the first part. What am I looking for? Yeah, I mean, we're going to continue to focus on mental health. We're going to continue to focus on drug addiction. These are the two biggest inhibitors from people living up to their full potential. They're costing the lives of many Ohioans. So we're not going to change that. This is going to be that focus will be continue. The amount of the dollars, we're not ready to tell you what those are. We don't know what those are yet. We're working through the budget, but the priorities are going to remain the same. So.
Does this report capture the impact of overdose addiction on children in elementary, middle school, high school, whether direct abuse or abuse as a result of parental addiction? Does it capture that? And if it does, going forward, what efforts are being made to ensure that children receive proper education and families are also helped?
Well, you know, one of the first things we asked the legislature to do in our first budget was we set aside specific dollars for what we call wellness. Wellness certainly includes mental health, but it also includes the drug problem. It's up to the local schools exactly how they spend that. I don't know if anybody else wants to add anything. Anything? Got it?
So we know that almost every single school in the state of Ohio that reports to the Ohio Department of Education and Workforce is providing some level of prevention programming during their academic year. So we are proud of the movement that we have seen amongst our school districts in doing that sort of intentional education during the academic day to educate children on the dangers of opioids, other drugs of abuse, and other risk behaviors. I'll add that back in 2017, when Mike DeWine was still Attorney General, he also launched a program called Ohio Start, which is a program that now sits at the Department of Children and Youth that focuses on helping parents who are struggling with child maltreatment and substance use disorder immediately access treatment, and also provides their children with access to trauma-informed care associated with their parent substance abuse. We've served more than 2,000 Ohioans with that program since the governor launched it in 2017, and that continues to be an investment that Ohio Moss makes on an annual basis.
Anybody else?
Governor, I have a question about Intel, actually. Based on your conversations with them, is there any risk that they would leave the state entirely? Would you make
No. Look, they're putting billions of dollars in the ground already, and they can't move that, so they're not going to leave Ohio. I did reach out to the White House today to ask them to speed up the money going to Intel. This has been something that has been lingering for quite some time. It's very important. It's important to Ohio. It's important to the future, I think, of this country. So I did reach out to them today.
Are you frustrated that Intel that the state has dispersed its money in grants and yet the federal government hasn't, and now construction will be flatlining for the next year?
Well, I don't look for it to be flatlined. I look for it to continue, but it is now time. I know that Intel has been going back and forth with the administration, but it's now time to get this done. And that was my message that I sent to the White House today. Really? Yes. Well, I think we're going to have a very close race. I don't think anyone has ever thought that this is not going to be close. This race will, between the two candidates, they will have spent, I think, more money than maybe any race in the history of the country. I don't know, besides presidential. So it clearly shows both parties are all in the race. Both candidates are all in. It's going to go right down to the wire, obviously. I'm voting for Bernie Moreno. I think he will be a very fine United States Senator, and I think it's important that Republicans control the U.S. Senate. So, but it's going to be close. I mean, it's going to be close, yeah.
If former President Trump wins and the federal government comes in and tries to round up Haitian immigrants and other immigrants, how is the state government going to respond to that?
Well, first of all, look, when you deal with immigration, this is clearly not only a federal responsibility, but the state really doesn't have anything to do with it. I can express my personal opinions. I can express the opinions of what I think is important for the state of Ohio, and I certainly will do that. But as far as action, this is a federal issue, and the federal government has pretty much exclusive authority in this area. I was asked the question several weeks ago, what would happen if all the Haitians were gone from Springfield? And the reality is that some of the economic progress that we have made, that Springfield has made, would go away. These Haitians came here to work. They were hired because they would work. They were hired because there were openings that could not be filled by companies. So theoretically, if you take those all away, obviously it's going to slow down the comeback that is being made by Springfield.
Who did you speak to at the White House? Did you speak with the president, and what was the feedback you got?
I contacted Steve Ricchetti.
What was kind of the feedback you got from them?
He's looking at it, see what they can do. Yeah.
Have you given any more thought to
Any more thought to what? I'm sorry.
What your course of action would be if issue 1 passes?
Well, if issue 1 passes, issue 1 passes. You know, we'll cross that bridge when we come to it. Look, I mean, I know that there's been a massive amount of money spent, particularly by those who support issue 1. A great deal of this money, most of this money is coming from outside the state of Ohio, which I think is somewhat disturbing. People ought to at least understand that and know that. What issue 1 does is it compels whoever draws the map, gerrymandering in every single district in the Ohio legislature, 132 districts. Each one would have to be drawn so as to favor one political party or the other. That is, by definition, gerrymandering. So it is ludicrous for the issue 1 argument. Those who are in favor make the argument. The argument, I think, is ludicrous that this does away with gerrymandering. It creates more gerrymandering. It makes it so that whoever draws the lines has to draw them in a way that is gerrymandered for every single district. I think you'll end up with fewer competitive districts. I think that you will see the loss of more. I think what will end up happening is each party's members will focus more and more on their own primary and less on the general election. And I don't think that's particularly good for the future of the state. Yes, I've not changed my mind. I mean, I think, you know, instead of drawing every district based upon the last election and gerrymander in each district so that one party is favored over another party, instead of doing that, I think what Iowa did makes sense. And you simply you focus on compactness. You want districts that are compact. You want districts that do not tear up political subdivisions, divide people in smaller communities and larger communities, which is what issue 1 will do. What Iowa does is they just start drawing maps based on population, and it seems to have worked pretty well for 30 or 40 years. Have I done what? I'm sorry. Well, I think we have an issue in front of us. We need to deal with that first, though. You know, look, I mean, when I spoke about this and did a press conference, and I think all of you were there, most of you were there, I said, look, here's why I'm against issue 1. But I also said I owe it to the people of Ohio to tell people what I'm in favor of. And I outlined what I believe is the way to go. I think it is really, if you ask people what they want, they don't want their districts, they don't want one city to be represented by a whole bunch of different representatives unless that is necessary based on the population. They don't want their townships torn up. They don't want their villages. And they also want districts not to look like some crazy animal. They want it to be compact. Issue 1 says those things are not important. The only thing that's really, really, really important is proportionality. And that means you have to draw every district and focus on preferring one party or another. You'd look at every district, and the map makers would have to say, this district will be favored by Republicans. They'll be more likely to elect Republicans. This district more likely to elect Democrats. I don't think that's what people want.
Would you still consider putting forward a constitutional amendment to reverse it or put a different system forward, even if the voters choose?
Well, look, well, voters only have to choose what's in front of them. But I'm not going to talk about that. We'll see what happens on Election Day. So.
Whenever we do figure out the results of the presidential election, looking sooner rather than later, if former President Donald Trump does win, are you ready to tell us more about who he might nominate to the Senate?
No, probably not. No.
When would you make that announcement?
So look, I mean, once this election is decided, and whether that's election night or I read an article, quoted the Fox decider who they asked him when he thought it would be, and he said Saturday. I have no idea when it'll be. No one does, but you know, it could be a few days. We'll see. But then, once that occurs, and if Donald Trump is elected, then we will start our process to look at people and talk with people. Some people have already contacted me. I've already met with some people at their request. But we'll get down to it after the election, if that's what happens. Well, the only timeline would be is when the vice presidential candidate would be sworn in, and he would have to, obviously, he will control that because he will control when he resigns and what date he puts on his letter of resignation. So.
Like how many people have contacted you?
No, I'm sorry.
Like how many people have contacted you?
Well, we've had a few people interested, so yeah. I'm sorry.
What priorities do you have for late that session?
Well, we'll see. We'll talk about that after the election. So we'll get to it. We've got a few obviously priorities, but we'll see. So thanks everybody. Thank you.
6 hours away, Dr. Vanderhoff, do you have
Oh, go ahead.
Do you have research for how many Ohioans in 2023 were in active addiction versus in 2022?
That's a very good question. I'm sure that we do. I don't have that immediately at hand. We can work on getting you that information.
Thanks everybody. Thank you all.